future is bright.
Hey guys, welcome to my channel. My name is Ashley and today I'm going to be doing a 37-week pregnancy update. I cannot believe that I am pretty much in the home stretch already, and I'm already to where they call it the near term. So if baby's already born at this point and on, then for the most part, if all goes well, everything will be okay with baby. So I'm so glad that I am this close already. I like to start off with reading from the Ovia app, and it just gives you a little bit of what's going on with baby and mom, and then it'll tell you roughly like how big the hands and the feet are. So it says, even though baby is over 6 pounds heavy and 19 inches tall, the size of a honeydew melon, close to birth size, cooking for a couple more weeks can do nothing but help, as she continues to put on that adorable baby fat that you're going to spend so much time hugging and kissing. It says she keeps inhaling and exhaling amniotic fluid as her lungs prepare to make their grand entrance into the world. It also says baby's lungs keep getting ready to breathe, and she's just about the size that she will be at birth. So it sounds like baby's not going to grow much more from here, from this point on. So that's what it says about baby. Let's see. As far as mom, it says baby may still be packing on a little bit of weight, but you've probably reached as big as you're going to get, and if you haven't, you will soon. The due date just keeps approaching more rapidly, so definitely make sure you have everything in order for your trip to the hospital. Let's see, you might start to notice new stretch marks in different places as your uterus is reaching its largest size. You might also be continuing to deal with some icky heartburn. As your cervix thins, you might start to feel a bloody mucus discharge that indicates the blood vessels in your cervix are rupturing as you prepare to give birth. So that's what the Ovia app says. Now let's get into a few other things that have been going on for this week. Like I mentioned in the last update, I'm not going to be reading any more from the notes because I just feel like as the weeks are going by, there's not much of a change, but it's more like symptoms than anything. So as far as in other words, like my rings still fit me. I haven't really gotten swollen. Let's see what else. As far as symptoms though, I have had insomnia a lot this week. I dealt with it in the past couple weeks, maybe once or twice a week, but this week, for whatever reason, almost every day I've been waking up like at 2-3 a.m. and just staying up for about an hour or two before I'm able to fall asleep again. I think a lot of that has to do with the fact that I'm like trying to finish everything before baby gets here. And for the most part, I feel like I have finished like with my home. I just have a few last minute things to put into my hospital bag, and then I did want to do freezer meals. If I don't get to the freezer meals, I'm totally okay with that. But that, I think, is why I've had insomnia, just thinking about last minute things to get done. As far as heartburn, I haven't really dealt with heartburn maybe but once this week, and I know it was because I've been craving spicy since pretty much my second trimester, and I did have 2 jalapenos with bacon and cream cheese. They were so good, but I so regretted that afterwards, and that's the only time I've had heartburn this week. I've also I've also experienced something that I've experienced my whole probably 3rd trimester, which is like incontinence, dealing with the fact like if I get up too quickly or if I sneeze or cough or something that you pee a little bit. I know that the baby is right on my cervix right now. When I had my appointment last week, my 36-week appointment, she told me that she did feel the baby super, super low. So I know that that has a lot to do with it. She's just putting a lot of pressure on my bladder. And almost every time that I get off the bed or the couch, I need to go pee. Like every 2-3 minutes, I'm having to go pee. And it's just that pressure. Like I always feel like I'm not fully, I guess, empty. I don't empty my bladder fully when I go to the bathroom. I'm just continuously having to go pee. So that's definitely something. I've also noticed a increase in Braxton Hicks. I know that my body's preparing. I've continued my red raspberry leaf tea, and I'm up to 3 cups already. So I know that that's also contributing maybe to the Braxton Hicks, making my cervix contract a little bit, become stronger. So I know that that may have something to do with it as well. And the Braxton Hicks are definitely not painful. They're just a little uncomfortable because it's the tightening of your uterus. So I definitely have to kind of stop and I kind of breathe a little bit. Not at all painful, just a little uncomfortable. And yes, so I've noticed an increase in Braxton Hicks. I haven't really noticed cramping just yet, so I don't think that I am getting anywhere with those Braxton Hicks, but I do know that I am feeling a lot more Braxton Hicks, not cramps so much though. Also, my daughter's trying to come in. Also, I've noticed, for whatever reason, 37 weeks is when my belly button decided it was going to become an outie, because I have, if you've been watching my updates, I mentioned up until now it had not come out, it had not popped out, and then all of a sudden one day I woke up and I kind of felt it and I was like, okay, what's that? And I went to the bathroom and it definitely popped at 37 weeks. Let me know if that's happened to you this late in pregnancy, because I thought that that usually happens sooner and it just happened for me for whatever reason. I don't have any new stretch marks, and let's see, as far as maternity clothes, I have not gone out to buy any. As a matter of fact, I'm wearing my husband's t-shirt. It's just so much more comfortable using his t-shirts rather than using mine, and they're all tight on my belly. So I am definitely noticing this belly pop, and that's about it as far as the changes this week. I haven't really craved anything different than I had the past couple weeks. Just still spicy. And let's see, I know that the past month or so tuna was a craving, and I still kind of want it sometimes, but not as much as I did before. I want to say that that's it. That's it. I'm just preparing my hospital bag now. I've got everything else done. The cradle's set up, clothes are washed, her boppy's washed, everything is ready to go. Just need the hospital bag. And then I'll be ready for baby, and at this point baby can decide to come at any moment, and I'm so ready. I'm so ready to see her. I'm excited, I'm nervous, I'm feeling all the different emotions that is pretty normal to feel when you're about to have a baby. So now let's get into the bump shot. As I mentioned, my belly has definitely popped. I do see a huge difference, and it's only been a week. Just from last week, I've noticed that it just kind of just popped. But it's definitely hard. I feel definitely the butt is up here because I do feel kicks like up here and on both sides. So my OB did confirm that baby is still head down, which is great news. But this is it. This is my 37-week bump. Thank you all so much for watching. I really hope that if you are pregnant right now, that everything is going well for you, that you're not having to go and experience a lot of symptoms other than what the typical pregnancy symptoms are. And I hope that you are having a healthy pregnancy. Thanks again for watching, and I will see you in my next week's update if baby decides to let me get that far for my 38-week pregnancy update. Bye.
You and I, we got it.